Thanks, Jim. And I know there's been a strong desire from the members to get a greater understanding of the funding and the governance and the oversight. And I know Jim has provided other material on our site as well that will be helpful for you. Sorry, I should have mentioned at the start of the session, I know the last session can be reasonably impactful for some people. And I just want to remind that we do have the supports from Anthony and his team from the HSE if anybody feels the need to take time out and have a chat with the team here. And thanks again for your supports on that. Okay, I'm going to move to Brian Galvin again, who'll be familiar to all of us from the Health Research Board, to share out some information further for us related to the area of prevention, our governance and funding.
Okay, thanks very much, Paul. And thank you all very much for the opportunity to speak to you today about this topic. I've attended all the meetings. I've really enjoyed it. It's been a great experience. I've met quite a few of you in the social spaces around the Assembly over the last 6 months or so. I'm hugely impressed by your curiosity and your diligence and the seriousness with which you take on this extremely important task. In many ways, the task you have is similar to the task that people have when they try to make public policy. You've got to, first of all, identify what the actual problem is, and then consider a range of options for responding to it. And policymakers have to think about implementation as well. At every stage of the process, of the policy process, evidence is essential, different forms. In the HRB, we're concerned not just with generating evidence, but making evidence available to the people who make decisions in a way that makes that process easier. To support that, to explain this process, I'm going to use a model called the research ecosystem. It's often used in the wider policy area, but I think it works well in drugs too. I'm going to refer to some of the presentations that you heard at earlier meetings, so you can see how this information is used to understand the problem, decide on the best options for dealing with it, and working out how to apply them in the real world. So, evidence ecosystems are networks that help the creation, dissemination, and use of evidence. In this light bulb image, there's 8 different types of evidence, and they're all relevant to our work. I'm just going to go through 3 of them to give you a sense of what its evidence is. The first is the analysis of raw data. As you heard from my colleagues in the HRB and the EMCDDA, I've trouble remembering that sometimes myself, we have very rich sources of data on drugs. You might remember that my colleague, Susie Lyons, presented data on drug-related deaths, I think at the 3rd meeting. And that data is hugely important in supporting harm reduction measures such as the supervised injecting hunter. And Marie Carew spoke to you about the latest treatment demand data. And this is essential in planning services and deciding what types of treatment are needed. We estimate heroin use by combining different data sources, essential information for observing trends and planning harm reduction programs. Qualitative research is a different type of evidence, and that provides insights into experience. We've heard quite a lot from those with lived experience of the last sessions, and qualitative research is a means of gaining knowledge from experience and using it to help treatments. and evidence synthesis. This involves gathering together the best quality international evidence. So we've got a good overview of a topic. I just want to give 2 examples of systematic reviews that we've commissioned. One on gang violence, and that informed the DRIVE initiative that you heard at the last meeting. We recently published a review on service user involvement, and that's been a theme through a few of the meetings, especially when the lived experience is spoken about. So we have a lot of the elements of the evidence ecosystem. We have excellent information systems. We have the HB National Drugs Library, a committed community of researchers, and other resources. There are gaps, though. I'd like to pick a few particular evidence forms where there are opportunities to do a lot more work and increase our knowledge. We need more secondary data analysis to really make use of the evidence resources that we have. This will help us to combine information across different data systems and make connection between health, criminal, and laboratory data. You heard from the meeting on health services about the HSE's treatment services. And these interventions,
2 minutes, Brian.
Yeah, and these interventions are based on evidence, but we need more information on impact. You heard about the innovative work that the HSE are doing in new information in areas like drug testing and syringe analysis. And we need more of that work in a changing drug environment. It's an uncertain future, but there are ways of identifying possibilities and preparing for them. We can have an impact now for what happens in the future. So how do we develop this ecosystem and create the type of collaboration and openness to new ideas that will result in better informed decisions? I think there is an opportunity now to create something that is far-sighted and could serve as a model to other countries and other policy areas. What I have in mind is a substance policy research centre. This could be put together through a collaboration across universities and government departments and research centres. It would provide the opportunity to do research across different disciplines and a place where it can test a range of new ideas and models and connect to international research. We'll be able to deal with uncertainty by identifying the possible threats and opportunities in a way that looks to the future in a strategic way, not just reacting to events. And then the evidence policy ecosystem can be created and build knowledge that will be of use for generations to come. Thank you.